America getting back in business. The national reopening plan hit the streets last Thursday afternoon, and things are starting to roll. Even Michigan's governor, likely the most tyrannical of all the governors, has relented, planning a May 1 reopening. Some states moved immediately to remove total prohibitions on places like public beaches in Florida while maintaining strict social distancing measures. But the gating criteria to enter phase one of the national plan is not going to be met very quickly by many states, such as Louisiana, New York, and New Jersey. The gate requires 14 days of measuring three areas of symptoms, cases, and hospitals to enter that phase. Now that virus epidemic peaks have been reached in states like Louisiana, downward trajectories in the symptoms, cases, and hospital capability categories is being reached. However, the requirement for a robust testing program has not been met yet, according to state officials. As recently as the April 20th Louisiana governor's press conference, a medical expert projected the state wouldn't reach the capacity they estimate they'll need until the end of May, meaning a capability to do 200,000 diagnostic tests per month statewide. That's set by the state and may differ across other states. The greatest limitation, believe it or not, is the limited availability of the various swabs needed to take a sample from a patient. We need to be able to do all of this simply to be able to respond rapidly and appropriately when the second wave arrives. An inevitability that no amount of social distancing or economic closures will prevent. Rapidly and appropriately likely means less painful if we've all done our jobs right and successfully phasing this reopening effort. In our next response, before we have a vaccine, we'll be capable of precision targeting instead of relying on broad swath approaches to mitigation measures. Louisiana's governor and President Trump have both said they are on the same page, and that appears to be so. In the same April 20th press briefing, Governor Edwards announced reopening of non-essential medical care operations and said he hopes to meet the gate requirements by May 1st, while stopping short of an economic reopening process. The state legislature and the governor are set to work together, with the legislature establishing a reopening task force last week. But what will the reopening look like? How will the recent disaster of negative oil prices affect the timeline, and if at all? Will we reopen by region, or can we do it by parish? That's what we call counties here in Louisiana. My own Louisiana State Representative, Mark Wright, says he's been involved in talks with his colleagues for weeks, and he joins me today to discuss their thoughts on reopening the state and how we get back to open for business in this country. Louisiana State Representative Mark Wright joins me. Mark, welcome to the Rob Maness Show.
Thanks, Rob. I appreciate it. Looking forward to this opportunity to talk.
Yeah, I hope you and your family are well. And ladies and gentlemen, Mark is my state representative, so we actually don't live far from each other. But with today's environment, we're not seeing each other very often. So I wanted to get him on the show and just talk about what he and his colleagues have been discussing about reopening the state from a state legislature perspective. But first, Mark, man, we see oil barrel prices below zero. What impact is that going to have on the economy itself in the state of Louisiana and the country? And is it going to impact us getting back open for business?
Yeah, sure. No, great question. I mean, a bit of a shock yesterday when you saw it go there. I've read some, good analysis of the futures markets, and they tend to say that negative price kind of came more from a feature of the futures, commodity futures trading, and that we should expect to see it go up, but nevertheless, it will not go up significantly, higher. My understanding, of our budget is essentially that every dollar lost for a price of oil, barrel oil, is an $11 million hit to the Louisiana budget. So if you're looking at how we budget out approximately $57 a barrel. That's a huge hit. Just do the quick math, you can see it. Hopefully, by the time we start moving, we'll start to see it creep up. But as far as an economic impact, Rob, I mean, this state just like I do. It's very much part of the industry in this state. I mean, everything from the maritime offshore world to uh, all those, everything from up to Shreveport on down into the Gulf. It's a big part of the economy and how people make a living. So I think you've got a really important question here as to how this is going to pan out for us.
Yeah, and you and I are both free market type folks, both principally and in action. I know that. Is there a threshold the state government looks for as far as price per barrel? And the reason I ask that is that I've been in discussions with small business oil men and women all over the state for some time now, and I've heard from them. And they were like, the president really ought to look at putting a tariff on oil to get it back up to about 45 a barrel, so this can at least be livable. That wouldn't even be perfect, though. Is there a threshold number that the state looks for?
That's a great question. I know, the budgeting obviously was $57 a barrel. Frankly, from our perspective, I know, people that like you and I tend to think from a free market and try to budget that way. I've never been comfortable with the idea that we budget based off of royalties. To me, that should be more in line with infrastructure payments, things like that. You shouldn't budget operations off the price of oil because it can, have such a flux. I've never really thought through the question wise, as far as establishing some kind of floor, whether the president would do something, whether it be, import tax or something along that lines. I've heard, I've seen a few things about just completely banning importing of oil versus things. To me, I don't know. I'm always nervous when we go into that area and try to fix something because it tends to have an unforeseen situation arise in a lot of ways, quite frankly. I know, for example, a lot of the jobs related to oil, petroleum in our state have to do with refining. So we'll import foreign oil, we'll refine it here, and then we ship it back out. So it also has, an export factor. Clearly, last few years, in our state, but especially in Texas, up in Pennsylvania, the shale plays, so to speak, are a whole new market, creating a whole new set of jobs. And I don't know how that would be affected by those kind of steps. I would maybe get somebody from Loga to come in and talk to you about it. I think they would know much better than I would.
That's a whole different show, but it is a good segue into, you mentioned non-government, government intervention. Obviously, we see eye to eye on that. We both are hesitant to even entertain the idea in most cases. And now we find ourselves where the federal government, state government, the local government, and all the way down to the family government, we have basically put almost a complete stop on economic activity in the free market in the United States of America, and much of the part of the world has done that. But we're looking at reopening. And the reason I wanted to get you on is twofold, Mark, is that you're a state legislator, and we've been doing a lot of national stuff, but it's time to start looking at these states that were really hard hit. And Louisiana was one of the top three, in my opinion, as far as being hard hit by the Wuhan virus. But the other thing is, you've said that you guys in the legislature, your colleagues have been in discussions for several weeks now and talks about what specific items y'all need to look for to try to facilitate getting done to get us back for business. And what are those? And if you can talk about them, and what can we expect from the legislature?
Yeah, sure. Well, I think what you saw in the last week or so is legislators sort of stepping up in a variety of ways, letters to the editor, press releases, letters to the governor to suggest that, we think it's time to start opening up in some way, shape, or form. Obviously, we still have a very critical situation when it comes to the health of our citizens that we need to pay attention to. There are some methods in which we could strike down an order. Some that has been mentioned occasionally, both in conversation and the press. I think that's very unlikely, though. I know you'll appreciate that we've got 40 new representatives, over 40 new representatives in the House, for example, and a good chunk over on the Senate side. So we have not gone through a real session yet. And what you have is a lot of people that are just kind of feeling their way through this. And, rightfully so. That, it takes a bit of time to get comfortable being a legislator. There's no doubt about it. And so because you don't have that sort of trust factor in communications and understanding your colleagues very well at this point in time, I think there's been really no movement towards trying to do something like that where you would have to essentially fight the governor to do it. I'm not comfortable. I'm going to say this. I'm not confident I would go with something like that either. But
Well,
certainly,
the governor and the President Trump have both said in recent days that they're on the same page, and it appears like they are. I mean, what would be the fight if there was one?
No, that's exactly right. I mean, what you saw break in the last week is the governor taking steps to show that he wants to open up, at least in phases. Everything he said seems to be in congruence with what President Trump put out. So in my mind as a legislator, while I'm uncomfortable with some of the things we've done, I do feel confident that we're seeing a movement towards that step. I think one of the biggest questions is, how do you do it? Clearly, you've got different parts of this state that are more affected than others. Some people have talked about letting parishes decide. I'm pretty confident I saw a quote from the governor yesterday saying he did not like the parish deciding. Looked at it more regional was the way to put it, to do it, which is understandable. I mean, Jefferson, Orleans, that type of stuff. But I think at the end of the day, you've got to deal with the local government as it's set up. So if Orleans says, hey, we're not going to open up for 15 days, and then I know the mayor there has talked about not doing any sort of large gatherings for the rest of the year, that seems to be the authority. That's her decision. Jefferson, I understand, said 2 weeks from now they were planning on opening it up. I know St. Tammany's taking steps. So you're seeing local government step up and make decisions as they can, but the governor, I think, sets the pace in the state. Clearly.
Yeah, I think I saw the governor mention that the other day too, and he also mentioned, are you familiar with the medical regions the state is organized in? I think it's 9 regions, and New Orleans and Jefferson Parish are in Region 1. He mentioned, based on the logistical spoke and hub concept in the medical regions, that they might consider open by region. I do think we need to go in a direction away from statewide. I mean, that's what most folks say. I mean, I'm not in the government and like you guys are, but I've been in these decision processes many, many times, even in a pandemic in 2009. And it appears that based on the data that I'm seeing, that could be a logical pathway. Hopefully we'll go that way, but you never know. Things could change tomorrow, couldn't they?
Definitely. I mean, look, I think one of the things we're missing at the public debate level is why we started this, right? Rightfully so, people are concerned about lives, about deaths. Mm-hmm. But at the end of the day, it's kind of difficult for us to completely stop that. I mean, even in our most locked down state, we still had people catching the virus and dying because of comorbidities, as they said. But the reason we started this, and I think it's a valid reason, is we wanted to make sure the hospitals were not overwhelmed. We wanted them to build capacity to get used to dealing with this. And so it makes sense to me that some hospital regions are going to be better prepared to move forward than others, whether it be because you don't have the patients that other regions do, or because you just simply ramped up to the extent that you're prepared to deal with whatever comes. So I appreciate that train of thought.
Yeah, especially I've been monitoring the data. The 2 key pieces up to this point that were the most reliable really are hospitalizations and patients on ventilators. Once we identified that the capacity reduction, hospital capacity reduction, and preventing that from being overwhelmed was the mission of the stay-at-home orders and those kind of things. And I think you're right. I don't think or believe for a second. Studied history on pandemics and been involved in the swine flu one in 2009 myself, that you're going to get out of creating infections when you open it up. It's just going to happen. We've got to keep working hard to focus on, I think, hopefully y'all are talking about this, the nursing homes, especially the veterans homes that we have in the state. We know the one in St. John Parish has just been decimated. And I think a lot of the deaths that have come out of Louisiana are probably nursing home oriented in some way or another. It's no surprise that the St. John Veterans Home is close to the New Orleans metro area, and that's where the most of our infections and unfortunately our deaths have come from. Do you think that we'll still be asking older people to stay inside and break the younger folks free, take that kind of approach? I mean, I think that makes sense to me, being concerned about lives still, but also recognizing that, hey, it's going to happen and we've got to get open for business.
No, I think you hit it. I mean, ultimately, as we move forward, individuals will have to make their own decisions, take some responsibility for their decisions. Hopefully they'll be informed by, government and medical information. But, look, my parents are in their late 70s. They should, as far as I'm concerned, if they want to protect themselves, they need to stay home as much as possible for this next year until we see some sort of vaccine or an ability to antibodies, as you mentioned earlier. I had a conversation with a small business owner in Covington a couple of weeks ago. We've talked, on a weekly basis, and he's an LSU fan, never missed a game at Tiger Stadium, in his adult life. And he said, look, I know I'm not going to be able to go watch a game probably for a good year or two. So I think those people get it clearly. And there's other risk factors, as you know. I mean, one of the things that's, really tragic is I think they said about 70% of the deaths has come from the African American community. Now, we know there's some risk factors health-wise that probably match the concern, the risks in the coronavirus. So, it's unclear exactly how that worked out. But whatever the risk is, if you're part of that perspective, you're part of that group. That's where we're really going to have to rely on people taking care of themselves in the community, whether it be local or state, trying to find ways to help them adapt, right? And so to your point about, we'll probably see a lot more young out and about. I mean, we'll see a lot of telecommuting. I mean, I think this has opened up, just what we're doing here, it's opened up a number of ways where I think people were not ready to take that step, but now we're thrust into it and probably feel comfortable producing in these ways, via, video, Zoom, whatever the case may be.
Yeah, I'm personally excited about some of the opportunities that it opens up, like more homeschooling. And, I had some disability reasons why I'm homeschooling my youngest son, but a lot of folks don't like the public curriculum and those kind of things. And if they're more comfortable doing that and it results in a more educated population of young people growing up, I'm all for things like that.
Yeah, I'm all with you. We homeschool too. In fact, my daughter is a sophomore in college. She came home, and so the whole family's here. But we work through a curriculum with a group of families attached to it's a hybrid actually. They go to school 2 to 3 times a week, but it's primarily an online type of process now. And so point being is we're very comfortable with that, but a lot of people aren't. And I think it's been good to introduce people to what families do when they homeschool and why, for example. I mean, we all have our reasons, and it's been interesting to see the response from people out there that they're much more open to this idea than I think were before.
Yeah, and Mark, we got time for one more question. I think it's something that I know you're interested in because we see we're aligned quite a bit on policy. And that's on liberties, individual freedom and liberties, and what we've seen through this. We've been very fortunate, I think, here in Louisiana. We've seen very little of this craziness that the president's even called out in Michigan and Wisconsin and Virginia and some other places. But really, the governments at all levels being able to suspend liberty, I think, is not the way the American people expected something like this to go, and more of the approach of, hey, here's the guidelines we need everybody to follow. It's on you to do that. And that's the way Americans are used to doing things. And then when you make your decision, you've made it for yourself and your family and those kinds of things. Are you guys in the legislature going to be taking a look at that? Because even here, even though we haven't had the craziness we could have, and there were some places that did have a little bit of craziness at the mayor and the sheriff level, but not like the rest of the country. Will y'all be taking a look at those kinds of things and looking at changes in the law under emergencies and those kinds of things?
Yeah, no. In fact, talked to a representative yesterday, actually Sunday rather, about this. I mean, I assume you saw in the news there was a federal court order about the law in Kansas, basically related to the First Amendment. And one of the things I said is it's going to be really interesting to see what comes from that. I know some other reps who are convinced that in some way we're violating, first Bill of Rights, First Amendment rights in ways that in doing this. I think the real question is, and this gets to the point of your question, is that, do you do that in the middle of this crisis when, you can arguably affect lives, or do you wait until it's over and then you kind of figure out how do we go back and address it? So I know there's an interest, and I suspect the right people will start to look at it. I'll try to be a part of that. I'm not an attorney, and my ability to kind of discern that is limited, but I certainly don't mind being part of the group to kind of push through that at some point. But yeah, we're going to see. I can't wait to see how this court case plays out, because I think it's going to have an effect on, potentially all 50 states. If you've got a sort of a coalition of the willing, if you put it that way, in the legislature to try to push the issue. But I think, back to the first point about it is this. When we saw those emergency orders issued, what you saw was a lot of compliance right off the bat. I'm Catholic. The Archbishop of New Orleans basically said we're not doing mass. That was difficult to take, but understandable. And except for that church in Central, I think you've basically seen sort of a quiet willingness, understanding, let's take these steps throughout the state. Unlike other states, we've seen the opposite reaction in some places as well. So these rights are important. There's no doubt about it. There's a reason why they're in the Bill of Rights. I think people died over this. We should be willing to die over this at some point. And we need to address it. But there is a balance, obviously, where you don't want to fight it out in the middle of a crisis.
Yeah, well, I think you'll get a lot of support. The reason why I wanted to do this with you, and this is for the audience, for my audience, folks, Representative Wright's here because somebody wrote him a letter, and it piqued my mind again, because I hadn't really thought about it myself. And folks were complaining about not getting things done or not being heard as far as things like liberty and getting reopened and those kind of things. And I don't think many people were writing letters that are calling representatives across the country at the state and local level, because they were thinking about, we got to comply or not, and those kind of things. So that's why I wanted to get a state rep on, and my own state rep, and you'll have plenty of support when you guys go forward looking at changing emergency declaration law and those kind of things to make them more American and a lot less overreaching government capability.
Yeah, no, you're right on. And I know we've discussed this. This is not to suggest that we think Governor Edwards hasn't done a good job. I think for the most part, he's worked with the tools he's had. He's attempted to, kind of protect the state, but also kind of respect some aspects of it. So you're right. Look, I rely on constituents to help me see what's going on out there, as an elected official. So there wasn't a lot. You're right. There was one letter in particular that brought some of this up. I think it's a complicated subject as far as, specifically whether that's happening, but also how do you go about addressing it? And, I've got a different approach than some others, but that's my option, frankly, but that's another story.
Well, I'm in total agreement on Governor Edwards. I think the President of the United States said the other day that Louisiana was lucky to have him. He and I share a mental model on decision-making from our military backgrounds. I've been in the chair where he's at many times. And I don't think I agree with every decision he's made. I've written about it. I've published it. But I haven't attacked him because I don't see a need to. And I thank God that we got the guy and that he's got the good sense to have a good team around him and listen and make good database decisions and try to improve the darn data at the same time. As we all know, there's been a big data issue. Well, Mark, thank you very much for coming on the Rob Manna Show.
I really appreciate it, Rob. Hopefully I'll come back down the road. We'll talk again. Thanks.
Absolutely. We'll have you back in the future, especially if we get to the point where the legislature is entertaining these emergency declaration laws.
Got it.